Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act.
Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are coming back to you once again with another episode. And this week, we are going to divide this one into two parts. We already know this ahead of time. We are such good planners. But before we get into what we're going to discuss, let us share our weekly Bible verse. And mine is coming from Isaiah 40, verse 30 and 31. And it says, even youths grow tired and weary, and young men stumble and fall. But those who hope in the Lord will renew their strength. They will soar on the wings like eagles. They will run and not grow weary. They will walk and not be faint.
Okay, I just want to put forth a little context. Ashley is currently starving and hungry.
On purpose.
On purpose. She's got some goals she's trying to meet and is doing very well, and I'm very proud of her for her fortitude. But she is feeling tired and weary in the afternoon these days because of a caloric deficit. So now I will give context for mine also, because we are doing oral health this week. So my Bible verse is Ephesians 4:29. Let no unwholesome word come out of your mouth, but if there is any good word for edification according to the need of the moment, say that, so that it will give grace to those who hear.
That is a good one. All right. Well, Andrea, we're gonna we haven't really discussed how we're gonna divide this episode, so that will be interesting. But we are going to be talking about oral health, and I wanted to discuss this with you because it's such an integral part of our overall health. Our mouth contains so much bacteria.
Oh my gosh. Yes.
And it's kind of a disgusting place. But it has a lot to do with our overall health, but also specifically our gut health. And so how would you like to get started on maybe oral health? I mean, okay, let's maybe do like a generalized, what do we as typical humans consider oral health? Brushing, flossing, maybe, typical mouthwash, rinse type thing. Like that might be like a typical person's like, oh, I do oral health. Would that be kind of a suffice?
And I think I'll just add a couple to that. Like culturally, I feel like we have just completely kind of lost our minds with regards to oral health, because oral health for the average consumer these days is like the premier important thing is to have white teeth, to make sure that they're straight, and that I don't have bad breath.
Yes.
And those are kind of the top three things. So you got white teeth, they are straight, and your breath smells like an angel's kiss. And so like if you've got that, then everything must be fine. But truly, those are kind of at the bottom of the list when it comes to true oral health. And while they're great things to have, you don't want to be knocking over someone 4 feet from you with your terrible breath, but it's usually indicative of something else going on in the mouth that is way, way more serious than just bad breath.
Yes.
Yeah. So, and I also feel like a lot of the interventions that we engage in oral health these days are not, a lot of times they are not good for our long-term oral health. And I don't feel like we get great advice from, the run-of-the-mill dental community representative, which would be your neighborhood dentist. So I don't know what other people's experiences have been, but Um, I've had a difficult time finding, someone who will just, "Can you just clean my teeth and just let me go home? Can we
Yeah.
can we just do that?"
Yeah.
So
Which
yeah,
is so fascinating because we were chatting about our dental experience
mm,
before the episode, and I've literally had the opposite. Like,
that's so
I've
great.
had great dental experience,
Mhm.
and especially here in Colorado, it's been really nice. I specifically loved our dentist prior to leaving the Front Range. She was an incredible Christian, actually loved her too. Like, he had never had a good experience either. So he
Uh,
was super anxious about going, and
yeah.
she was just awesome. So I
Oh,
know there's no there out there. And if you are a fellow dentist, not a fellow, but if you are a dentist, then
no
not
offense.
we love you.
Yes,
And
we
maybe
do.
you can shed some light on
Yeah,
on helping us figure out how to find a good one. So
yeah.
yeah.
Yeah, so I feel like we really want to make the point with these episodes that it's not just cosmetic. Like the good oral health is so much more important than just what you're seeing. And so, uh, again, a lot of the interventions I feel like need to be looked at in terms of overall health rather than just what is the end aesthetic goal. Does that make sense?
Yes, yes.
Yeah, okay.
So why you wanted to start off with, why is oral health even important?
Yeah, so some of those things I was alluding to, the deeper measures that we're trying to affect is that we I've done a lot of talking about the gut microbiome, and maybe we should talk about that on one of these episodes.
Oh,
We
we should for
probably should.
sure.
Yeah.
Yeah.
So anyway, if you consider that your gut, um, when we talk about the microbiome of the gut, honestly, we're primarily talking about the colon, right? The
Mm.
large intestine, because the small intestine should be, we used to say sterile, but it's not sterile. But it should have a way, way, way less inhabitants than the large or colon, large intestine or colon. So then you've also got some cool bacteria that live in the stomach and all along the digestive tract, really. And so if you think about it, the mouth is just the top of the tube, right? So from mouth to rectum, humans are essentially, we're kind of hollow in the middle. We've got this tube running through that separates outside from inside. And
There are
so,
many that would disagree with you. Just
well,
kidding.
well, maybe so, but we could have a conversation about why they're wrong. But anyway, so so the top of that tube is your mouth, and we're finding that there are so many colonies or microbiomes in the body, and all of them need to be kept healthy. So for instance, the eye has
Mm,
its own microbiome. Vaginal flora, obviously, right? When that gets out of whack, there's yeast infections and all kinds of other things. And so the mouth is no different. We've got a microbiome made up of various kinds of bacteria, probably some fungus and probably some viruses in there too. There's a lot of talk about the virome now. And so yeah, these are all created to be with us, and sometimes they get out of balance, or sometimes bacteria are introduced that are up to no good, and they can cause havoc in your mouth. So we need to protect those good bacteria that are meant to live with us in the mouth and that are not harming us and keeping harmful populations down. And so, also heart health. So, we've known for a very long time now that there's a link between oral health and heart health. And so, in fact, if you look, you can find where there's valvular damage. So heart valves, that's an integral piece of machinery in the human heart, right? The heart doesn't run without each of the four valves involved. And so those valves can become destroyed by specific types of bacteria. So there are actually reports about people with these types of bacteria in their mouths and then flossing very vigorously so that their gums bleed and potentially introducing those bacteria into the bloodstream, and then they migrate to the heart, and there are repercussions to human valves. So that's something kind of interesting to think about too. But then there's also brain health. And
Mm.
so what I find fascinating is that some of these bacteria, again, in the human mouth, that are not our friends in there, are have been connected to neurofibrillary tangles. Now, perhaps you've heard that before, or more commonly, you've heard the term plaquing before.
Yeah. Yep.
Yeah, so you think plaquing on your teeth, right? Where
Right.
are other places that we think of plaquing? Well, how about arteries?
Yep.
Right? Plaquing in arteries, that's also not good. How about plaquing in the brain? That is
Mm-hmm.
part of the neurofibrillary tangles, and that is related to Alzheimer's and dementia. So,
Mm-hmm.
these bacteria, it's really, really important, and we have yet to elucidate all of the mechanisms by which they affect heart health, brain health, overall health, but we are just starting to pull on that thread. So stay tuned to this space because I think there's a lot more information coming. And
Yeah,
then
it'd be fascinating.
yeah, it's gonna be a good space. And then finally, obviously we've been given one set of teeth, um, and there aren't any more coming. We're not sharks, right? We don't just replace them. They don't come down out of our heads. So you got one set of teeth, and it, hopefully needs to last you for the rest of your days, ideally. And so cavities, those are caused by a bacteria that is in the human mouth and actually passed along by spit, which is great. Um, so it can be transmitted from mouth to mouth. So you better watch who you kiss, is all I'm saying. But they can cause cavities. They can kind of drill through your enamel into the dentin and cause cavities. So that's another reason why oral health is so important, is just to save that dental tissue, because God willing, you're going to live a long time, and you want to make sure that your chompers are healthy.
Don't want to go back to baby food.
No, you don't. It is hard to chew a steak with no teeth. So,
Yeah.
yeah.
Okay, so um obviously oral health, not just your mom telling you as a kid you need to brush your teeth, not
Mhm.
just for that fresh breath. It's obviously
Right.
showing that it has heart, brain, neurological
Uh-huh.
effects on us too, right? And our gut microbiome.
Yep.
So where would one start if they were like, what's hygiene 101
Oh,
basically?
okay. That's a great question. Yeah, truly. Probably the biggest aha of this is not going to be news to anybody, but if anything is news, it'll be this, and that's that you should use a soft toothbrush. A lot of people like to really go at it. In fact, there's somebody in my family that nearly brushed all the enamel off of her teeth because she would brush so vigorously.
Wow.
And she was told, "You better back off of this, or you're going to literally brush your teeth away and expose the dentin, or the softer material of your tooth. You're going to expose that to bacteria and cavities if you don't back off." So yeah, using a soft bristled toothbrush is really important. You don't need to scrub them like you're washing off a stain on a rock, like, yeah, like you're trying to get a white shirt clean, and you're pounding it with a rock like in the olden days. You don't need to do that. Just a soft toothbrush. And then also, apparently, flossing is important. I did not come to flossing until later in life, because I had super, super tight contacts in my teeth. I still do, but as you age, your contacts will loosen up a little bit. So mine have loosened up, which makes flossing a whole lot easier, and I would say even possible now, where it wasn't before. But flossing is good. Um, I also think the advent of these flossers that kind of hold the floss in that little U-shaped plastic deal, with the
Uh-huh. Yeah.
handles,
Uh-huh.
those are a game changer.
Oh, they are. That's what we use.
Oh, they're fantastic. You just put those suckers in the car and just floss your teeth while you're going to work.
Yep.
It's super easy, and there's really no excuse for not flossing these days, because they've made it so easy. Now, the dental floss of old, where you had to wrap it around your fingers and then
Ugh.
that's just
Yeah.
ridiculous.
Too much.
Yeah, way too much. So, twice daily for toothbrushing and flossing is kind of the perfect, before bed and as you wake up in the morning. But if you're looking for the most important time, that is before bed.
But
Um,
please don't go about your day without brushing your teeth.
well, okay, yes, but there are those folks that are not, I don't know. I don't know why this happens, but some people don't brush their teeth twice a day. I don't always brush my teeth twice a day. Sometimes, like,
I'm very bad about it, so
okay,
I
yeah.
can't talk. I can't, but I do brush mine in the morning.
Okay, so if you're only gonna brush once, make it before bedtime. Um, just saying, switch it
All
up a
right.
little.
Well,
And I'll tell you why here in a little bit, but
okay.
you want to brush the fronts and the backs, and down at that gum line is really important.
Uh-huh.
Because that's kind of the defenses. And then I always so I take a page out of my oh my gosh, I love my toothbrush. I've had the same kind of toothbrush for, oh my gosh, over 20 years now. It is the oh my gosh, of course I'm blanking on the name. It's the OG electric toothbrush.
Like the Oral-B?
But no, it's before that even. Sonicare.
Oh
It's the
yeah, Sonicare.
Sonicare.
Yeah, yeah,
Yes.
yeah, yeah, yeah.
Yes. So I remember when those first came out, and I was actually teaching in a pharmacy tech program, and nobody had seen this kind of toothbrush before, the sonic technology. And they actually came to our school and gave the instructors free toothbrushes.
Oh yeah, that's the one we have too. Yeah.
Yes, I love Sonicare. It
It's
will
so
always
good.
be my toothbrush.
Yep.
So I like their system where you get 30 seconds in each quadrant.
Yes.
And if you want to get really exciting and like shake things up, you can do like the front and back of a fourth of your mouth and like break your quadrants up that way. Sometimes I do that to amuse myself. Um,
To be in Andrea's brain
I
sometimes.
I know. Anyway, so that's kind of the 101 on oral hygiene and what to do. And now we'll dive a little bit more into the nitty-gritty of it. And so the first thing that I kind of wanted to talk about was calcium. Like
Okay.
when you think of minerals that you need for good healthy teeth, does calcium come to your mind?
Oh, absolutely. Like drink your milk. Like
Right.
yeah,
Yeah.
you needed to get your calcium to make sure you were big and strong and that your teeth were healthy.
Yes, absolutely. And so, can you hear me typing?
Yes.
I'm sorry. I'm sorry. I need to look up this structure real quick. I'm Googling. Yeah. So anyway, yeah, I just wanted to look up the structure of hydroxyapatite because that is the new thing
What
in
is it called?
like functional. It's called hydroxyapatite.
Oh,
So yes, our teeth are made up of a matrix that involves calcium. However, the specific type of calcium, it's in a structure called hydroxyapatite. So that's the crystalline structure of the calcium, and it's in a very hard matrix. And so anyway, you can go to like a mineral part of a museum, where they have all the cool rocks. That was always my favorite place.
mhm.
And you can actually see hydroxyapatite crystals,
Okay.
and you'll know that is a calcium based crystalline structure. So anyway, in the human tooth, it is created out of hydroxyapatite. That's the specific form of calcium that is incorporated into our teeth. And so um, there is that is down in the dentin. And that's the bone part, which makes sense because bones have calcium in their matrix, right? That's what makes them
Mhm.
strong and hard. Um, so, do we need calcium? Yes, we absolutely do. Except that when you go to the dentist, they don't give you a calcium wash.
Mhm.
They don't we don't have calcium in our toothpaste.
Yeah.
So, what other mineral do you think of? Fluoride.
Well, yeah, fluoride. I mean,
Yeah.
I didn't know that was a mineral though. So,
Yeah, so fluoride is a mineral just like calcium, just like sodium. Um and but the thing with fluoride is that it can insert itself into the bone matrix of your teeth. And um it creates a very strong um it creates a very strong tooth. I'll say that.
mhm. Okay.
Okay. So, yes, does it work? Yeah, it works. Um, but I also drink water that has been filtered for fluoride. I mean, I'm on well water, so I don't have to do that anymore. But why on earth would I do that when
Yeah.
I want, I want strong teeth? Um, the reason for that is because I the poison is in the dose,
Mhm.
okay? And here is one of the issues that I have. Um, if you oh gosh, so fluoride is different than fluorine. Fluorine is kind of like chlorine gas, and that's not a good thing. And I'm just trying to there's organic chemistry is kind of it's a lot to wade through. But what I want to say here is that uh, getting too much fluoride can be neurodegenerative, okay?
Mhm.
So, we know that. That's not disputed. And so my feeling is the poison's in the dose, we know that too. Um, and so how do we quantify how much fluoride a human should get? Now that is my question, and that is my issue with all of this. And
Yeah.
I don't have a beef with anybody who uses fluoride toothpaste. I don't care. I think that's great for you. If you want them to wash your teeth in fluoride every time you go, do that. But here's the thing, like, do we need 2-year-olds drinking fluoridated water, using fluoride toothpaste? I mean, it says right on the box, absolutely do not swallow this. Well, why does it say that? Why are we
Mm.
putting something in our mouths that is not safe to swallow?
Right.
So anyway, there are lots of questions that I have, and I'm not super dogmatic about this. I just have lots of questions.
Yeah.
And I made some different decisions for myself and for my kids that other people might make different decisions, and that's fine.
Yeah.
We all ought to have the ability to make different decisions for ourselves and our health. So anyway, just for consideration, that's kind of where the whole argument on both sides is. You can easily find arguments for why fluoride is so important, but it's kind of hard to find the other side. And so I just like to tell people, it's not crazy people who are questioning fluoride. They're very valid considerations. There's no prescribed dose of it. So if you've got one kid that only drinks fluoridated tap water for their whole lives, they're getting a huge walloping dose versus another kid that only drinks well water for their lives. So how are you quantifying the dose necessary to harden teeth
Mhm.
versus do neurological damage or any other kind of damage? So that's my question on that.
Yeah. So, you kind of touched a little bit on the toothpaste. What have you found as something that you've liked to use?
Well,
Um,
Ashley, yeah, so I'm gonna need to type because I just found my favorite toothpaste, and
Oh yeah.
yeah, it is the bomb. It is doing so far. So I have really sensitive teeth.
Okay.
And so I do go through periods. So see, this is the thing. I'm not dogmatic. I do use like a sensitive formulation toothpaste
Hmm.
periodically if my teeth get sensitive, and it helps. And so then I go back to my non-fluoride toothpaste, and I just go back and forth.
Okay.
Um, but I have found kind of the most amazing toothpaste, and if you look at sort of the wellness brands of toothpaste these days, you'll like your kind of hippy dippy formulations of toothpaste, right? Um, they will often, well, they're always going to be fluoride free, but they will contain hydroxyapatite, which is the kind of calcium that we want that will go into your teeth and remineralize them. So, the toothpaste that I recently purchased was called Boka, Boka, and it's fluoride free toothpaste. Woo! Hi. Fluoride toothpaste. Sorry about that. It's remineralizing sensitive teeth formula, and it's amazing. I love it.
And where do you get it?
I got mine off of Amazon. I'm sure that they have a store, like a Boca store, but I just grabbed mine on Amazon.
Okay. And you said it's, well, send me the link and I'll make sure to put it in the show notes.
Oh yeah, I absolutely will. I'll do that now.
Okay.
So yeah, it's got a great minty flavor. I think they have several other flavors, but I really like mint in toothpaste flavor. So yeah,
Yeah. Yeah.
that's the
I've
stuff
been
I like.
using, and I don't think it has it, so I'll have to maybe switch up, but Himalaya is the one that I've been using.
Oh, what is that kind? Now, do you use fluoride free toothpaste?
Yeah, it's fluoride free. Hmm.
Okay. Have you always?
No, no, I just recently switched this year. So,
Oh, okay.
and
Okay.
I've really liked it. But it doesn't have that um hydroxyapatite in it. So
Oh, it doesn't.
that,
Okay. What does
well,
it
I'll
have in
send it
it?
to you. Let me send it to you real fast.
Okay.
Um, I think I showed it to you when I was up there, but that's been a while. So I sent it to you in the text message.
Okay.
Um, but I've really liked it. Yeah, no
Okay.
complaints. But I'm gonna definitely look into the hydroxyapatite stuff.
Yeah. Yeah, and I know sensitive teeth are a problem for a lot of people. I mean, it's gosh, when it's bad, it's really bad. Like the pain is just intense. So I know that's a problem, and that's why I was super excited to find this kind. I've made my own tooth powder. I mean, like I've gone through all kinds of iterations of like tooth cleaning stuff. So yeah, this is a really great one. Um, Now the next thing that I want to talk about is well, let's talk about spit, Ashley,
Okay.
because spit is super, super, super important, and I don't think that people give it its proper due. And this is one of the things that it's just kind of like you either win the spit lottery or you don't. And I feel really strongly about this. There are some people that, despite their best efforts at dental hygiene, like they do way better than I do or you do. They are relentless with their flossing and their brushing, and they go every 6 months to the dentist, and they get cleanings, and they get, all of these things. They're doing all of the things, and they still have cavities.
Yeah.
Still have cavities. So you know people like this. I know people like this. They truly, I believe they did not win the spit lottery. They don't have the proper, genetically speaking, they don't have the ideal oral biome habitat. Okay. And I think a lot of that is inherited genetically. Um, so
Now,
Mhm.
I mean, think you're gonna kind of get into the medications of this, but I, growing up, you know, I was also kind of taught that if you were somebody that was like on a lot of antibiotics as a kid, one that messes up your gut microbiome, and
Mhm.
that can also cause some health issues with your teeth.
I have no doubt. I mean, yes, that makes all kinds of sense to me. In fact, there's a relationship between rounds of antibiotics as a child. There is a relationship between that, and we don't know. It could just be correlation and not causation, but
Mm-hmm.
there's the relationship between rounds of antibiotics and depression.
Yeah.
As an adult. So there's lots and lots of impact from multiple rounds of antibiotics and oral health. That makes perfect sense to me in terms of the microbiome. But I also think that there's definitely something to this magic spit.
Yeah.
Because some people have terrible oral hygiene and they have no cavities. Now, I would consider my oral hygiene kind of mid. But I have no cavities. I've never had a cavity. And it's been a very long time. I've been
Yeah.
alive a while. And yeah, so I can only attribute that to magic spit, which is got to be a genetic thing. And so saliva is extremely protective. So what you don't want is you don't want your mouth drying out. This is a big, big, big thing. It's a big deal. So
Okay.
even if you were born with the magic spit, there are all kinds of ways that you can allow your mouth to dry out, where you don't get the protection that you do from having adequate saliva in your mouth. So there are a few ways that, well, let's just talk about sort of the circadian cycle first of all. So your body makes more saliva during the day than it does during the night.
Makes
um,
sense.
yeah, that did not make sense to me. That was something that I really had to think about for a
I,
while.
I mean, I just can see, God being like, hey, I know she doesn't want to wake up in a pile of spit. So I'm just going to make it so that she doesn't produce as much at night.
So you're not drooling at night. Oh my gosh, it takes too much effort to swallow. Okay,
I'm
well, all
I'm
right,
trying
Ashley.
to
All right,
sleep.
all right. Well, that makes perfect sense. Okay, well, yes. So that's clearly why we are created that way. But the saliva that we have, it contains like digestive enzymes and antimicrobials, and it also contains polysaccharides that can feed good bacteria. Like it's really, really cool stuff. Um, and so we want to make sure that we have adequate saliva. And there are lots and lots of medications that have what we call anticholinergic effects. So these are effects that essentially kind of dry you up. So I'm thinking primarily about like antihistamines. All right.
Okay.
So antihistamines, what do? Well, they dry you up. So, but not only do they dry up mucus production, like from your nose and your eyes, but they also dry up saliva production. So this can be problematic. And then I also want to mention stimulants. Stimulants are notorious for drying you up. So this includes ADHD medications. This includes stimulant weight loss drugs like phentermine. So when I'm talking ADHD drugs, I'm talking drugs like Adderall, Vyvanse, Ritalin, any of these stimulant amphetamine based ADHD drugs. Those are going to dry you up. So you don't have enough saliva production. And then the weight loss drugs,
I
again.
was just about to ask
Mhm.
about that
Yeah.
because I was like, that's a stimulant.
Yeah. Yeah, it absolutely is. And
So you're
I
going to be skinny, but your teeth are going to fall out.
that's right. Well, you don't need to eat anyway to maintain
That's
that,
true.
so
Just get the implants or
that's
dentures, you'll
that's
be
right.
fine.
That's right, until they fail, and then I don't know what you're gonna do.
Oh my
All right,
gosh.
so it's kind of ringing a bell also. I'm not gonna type it up and Google it right now because Leslie gets super annoyed when I type. But I'm kind of remembering that maybe even the new weight loss drugs, the GLP-1s,
Yeah.
I think they cause dry mouth too. But anyway, just I may or may not be right about that. But then there are also conditions that cause dry mouth. So one of
I
the
just looked it up and it is true.
it is true. Okay. All
Yeah.
right. Okay. I didn't even hear you type. You're so
It's
quiet.
because I'm so quiet.
Oh,
You don't have to
yeah,
pound it.
yeah, you're super quiet. So one of the conditions is Sjogren's. So this is a common autoimmune condition, and it doesn't show up on its own a lot, but you'll see it in conjunction with like rheumatoid arthritis or lupus. Sjogren's will kind of come along with those autoimmune conditions, and so people with Sjogren's will present with dry eyes, dry mouth, and there are a host of other things that happen as well. But Sjogren's is one of those where we would worry about oral health. And so then there is something else that we really worry about with kids in particular. And it can certainly extend to adults as well, but adults are easier to reason with and kind of change their behaviors. It's easier to deal with an adult who is a mouth breather than a
Mm,
kid who is a mouth breather, because kids, like, the kids with allergies, kids with chronic stuffiness and congestion, they will often be mouth breathers, and this really dries out the mouth.
mhm.
And then when they're sleeping, they also mouth breathe. And so, I mean, their mouth is just dry as the desert. And so cavities just breed in there. Because you don't have that protective antimicrobial, and so the bad bacteria can multiply, and cause cavities. And anyway, it's just a bad situation. So I will talk about what we can do about mouth breathing during the night. Teaser. I, I will talk about that next time, because
All right.
I think we have reached a good stopping point here. What do you think?
Yeah, no, I think the next part will be good to cover on
Okay.
our next episode. So,
Okay.
this was very interesting. Hopefully, it shed some light on some people for some people, and we'll link some. Maybe we'll come up with a couple of toothpastes that
Yeah.
we both like and put them in the comments. But like Andrea says, like it's all the damages in the dosage of it. So
Yep.
um which we probably should do a whole episode on like filters, water filters,
Oh
and
my goodness.
like
Yeah.
I mean that could be a whole nother rabbit hole that we could go down if you guys are interested. So
Yeah. Let us.
hit us up and let us know if that would be something that you guys would like us to cover. So all right, well, we will wrap this first part up right now, and we will continue with oral health in our next episode. Thanks so
Now
much
go
for
brush your teeth.
listening. Yeah, and go brush your teeth. Oh, you know what? I did actually have something I want to ask you about that.
Oh,
So if somebody, like, say somebody is a chronic teeth brusher and
yeah.
they
Mhm.
do multiple times per day, um, I have heard not to brush your teeth too close to finish eating because it's actually doing more harm than good. Is that
You mean right after you've eaten?
right?
No, I have not heard that. In fact, they will so people who encourage like really fastidious mouth hygiene will say if you can't get to a toothbrush after you eat, then at least rinse your mouth out with water.
Interesting.
Yeah, so no, that I've not heard that. That would not make sense to me. Because essentially, especially if you're eating anything like carbohydrate
Uh huh.
based, because that's really what these things eat.
Yeah.
is they break down carbs. Even, it doesn't even matter what the carb is. It could be a ring pop, or it could be like, super healthy,
Sweet potato.
a sweet potato. Yeah. They will take the carb and use it. So
Okay. Okay.
yeah. Yeah.
Well, busting myths over here.
That's right. That's right. And
Well,
we'll
as
talk more about that in the next one.
absolutely. All right. So as always, if you have enjoyed this episode or any of our other episodes, we would so appreciate you rating us on whatever platform that you are listening on. You can do so by going to, typically it's on the main page and scrolling down to the bottom, and there's usually some stars that you can click. And 5 stars, please. No 4.
Please.
Just
Thank you.
5. Just 5. And as always, we love hearing from you. So please shoot us an email or hit us up on the Instagrams if you have any further questions, or maybe there's an episode that you would love us to cover, because we're always trying to brainstorm some ideas that you guys want to hear. So if there's something that you'd like us to cover, shoot it over. But as always, thanks so much for listening, and we will catch you on the next episode.
Bye. The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.